And then you have the sternal end, it's kind of rounded and bulbous. So, like that, maybe like that, maybe like that. You need more information, right? It's not enough. So on the acromial end, one side is smooth, the other side has a ridge, and on that ridge, you have the conoid tubercle. That has to face down. So now we know it's like this, or it's like this. So it comes out before it goes back. So if I hold it on the left side, you see how it would immediately curve back? You can feel that your clavicle doesn't do that. So it kind of moves forward a little bit first, and then as you get to the lateral 2/3, then it dives back. So this must be a right clavicle. Make sense? So it comes forward before it dives back. What's next? Scapula?
Yep.
Pretty easy. Lateral, inferior, superior angles. So you know it's situated like this. The spine needs to face posteriorly. So this is a right scapula. Because if I get the glenoid fossa facing laterally and I hold it on this side, now I've got the spine facing the wrong direction. It needs to go like that. So right scapula. Next. You really just need two things, the head and the olecranon fossa. Right, so the head's going to face medially. It's going to go like this or like this. Olecranon fossa has to face posterior, so this is a right. Right, and the condyle is facing the anterior. Ulna next, is that right? Okay. So the larger proximal end has that C shape, and the inside of the C is facing forward. And this rounded part here has to face posteriorly, and that's this part of the elbow. And this little point here is the styloid process. So we've got the C facing forward, and this is pinky side. It's the medial bone in the forearm. So it either goes like this or like this. So you need one more piece of information. I use the radial notch, and it has to face the radius, which is just lateral to it, so this is a right ulna. If I hold it over here, it's facing the wrong direction. All right, so you have the disc-shaped head, and then the distal end has the styloid process. One side is kind of smooth, kind of flat. The other side is very rounded with these big lumps and ridges on it. The smooth part is in the front. So it's either going to go like this, this thumb side, it's the lateral bone, or it's going to go like this. So I look at the tuberosity and make sure that the radial tuberosity is facing the ulna, which it is when I hold like this, right? So it's a right radius. Just to confirm, if I hold it over here, it's facing the wrong way. What's next? So hands and feet, I don't have hints. Those are pretty obvious. I don't think I have one for the coxal bone, but we can go over it. So you need the ilium on top, pubis anterior, ischium posterior, acetabulum lateral. So I can hold it over here with the acetabulum facing laterally, but you can see the pubis is now in the back, the ischium is in the front, it just doesn't look right. Clearly it's a left coxal bone. And then femur. Head is on top and facing medially, so it either goes like this or it goes like this. The condyles have to face posterior, patellar surface anterior, so this is a left foot. Tibia. Medial malleolus is is on the bottom, condyles are on top, tibial tuberosity is in the front. So if I hold it up to the left side, this looks good, but down here, what's supposed to be the medial malleolus is on the lateral side. So it must be a right tibia. There. Fibula. Head, which is usually chewed up. Lateral malleolus, which is in good shape on this one. So if you look at the left-right hint, I talk about the angle that's created by the tip, and it kind of goes like this, and it should be facing down and back. Right, so inferior and posterior. So this is the lateral leg bone, angled correctly. This is a right fibula. But I think an easier left-right hint would be one side's flat, the other side's rounded. The rounded side needs to face anterior, and the flat side is posterior. That's probably easier. Is that all we have left, patella?
Yeah.
Yeah. Alright, so let's see, this one is right. You guys do have a left patella back there, right? Did I borrow your left one? Can I have it again? No. Thank you. Okay. So the left-right hint that's on the outline, it says base on top, apex on the bottom, lateral facet, laterally, medial facet, medially. So lateral, lateral, this is a right patella. Notice that ridge isn't quite down the center. It creates a smaller, more rounded facet on one side and a broader, flatter facet on the other. So that big broad one is the lateral, the smaller rounded one is medial. But here's an easier way. Base facing you, apex away from you. Set it down. If it falls to the right, it's a right. If it falls to the left, it's a left. Good?